First aid for head injuries from ReadySF. Injuries to the head can range from minor scalp wounds to severe brain trauma. Suspect a head injury for anyone who has fallen from a height of a few feet or more, has been involved in a high-speed crash, has been hit in the head, or has lost consciousness. Signs and symptoms of mild head injuries or concussions may include headache, nausea, or vomiting once or twice, dizziness, brief confusion, momentary memory loss, meaning that the patient may not immediately remember what just happened, brief loss of consciousness, in which they may appear to get knocked out, but come to or wake back up quickly, and temporary vision disturbances, like blurred vision or seeing stars. Signs and symptoms of severe head injury are much more dramatic and obvious. A patient with a severe head injury will appear disoriented and may repeat themselves or not be able to answer basic questions like where they are, what day it is, or even tell you their name. Or they may be completely unresponsive and not wake up to your verbal or physical stimulus, like you calling their name or shaking their shoulder. Signs and symptoms of severe head injuries can also include a severe ongoing headache, a patient who continues to vomit multiple times, seizures, most commonly recognized by uncontrolled shaking or muscle spasm, difficulty walking or staying balanced, and signs of skull fracture, like visible open fractures to the skull or bleeding from or bruising behind the eyes and ears. First aid management for head injuries means stabilizing the spine. Keep the patient's nose in line with their belly button and avoid moving or twisting their spine in case they also have a spinal injury. Place the patient on their side in the recovery position if they continuously are vomiting. This will protect their airway and is especially important if they are in and out of consciousness. Apply bulky dressings to control any bleeding from the skull. This would look like holding folded up t-shirts to the patient's head rather than pressing your fingertips into the injury with deep direct pressure. Call 911 for any patients showing signs and symptoms of severe head injury. To learn more about head injuries for children and adults, check out health.harvard.edu and kidshealth.org. Thanks.